Now, there is widespread speculation that President Cyril Ramaphosa will move South Africa to a lower lockdown level soon. We've been looking at COVID-19 cases, and all provinces seem to have passed their peaks of the third wave. The numbers have been coming down consistently in recent weeks. Let's look at the latest. We're joined by senior researcher at the CSIR, Dr Ridhwaan Suliman, who kindly provides access to his research in the form of graphs. Doctor, great to have you with us as always. So firstly, we're looking better. Give us the overall sweep in terms of the average daily cases, now below 6,000.
Good afternoon, Francis. Indeed, we continue to now see a sustained and promising decline across all indicators, which really is good news for us as a country. So nationally, we're seeing that the case numbers, the test positivity rate, hospitalizations and deaths are all moving in the right direction. Looking firstly at that number of confirmed cases nationally, we've reported an average of 5,746 new cases per day on average over the past week. That figure has come down by 29% week on week. If we also look at that figure in terms of the population size, it's just under 10 new cases per 100,000 people per day, and down to 29% of what we saw at the peak of this third wave.
Yeah. And this graph is interesting. Let's stay on it, because if I follow it, it seems like the last time we were at these levels, the last bar, you say down 29%, we were actually at level 1 or so when we were at these figures. Is that correct?
Yes, I don't have the exact figures of where we were comparatively, but I do think if we look at where we were at on an upward incline at a similar level, we were probably in level 1 or possibly level 2. We also need to take into account the test positivity rate, which I think was also above 10%. So all indication now is, if we compare to where we were at similar levels, we probably due an easing of some sort of restrictions at this stage.
All right. So, well, you mentioned the positivity rate. That's important because not everyone is getting tested. So it gives you an idea of the population. What is that saying?
Yeah, so we have seen that the number of tests that have been conducted over the past week has declined. Of course, due to fewer people presenting for testing and fewer people being infected. So testing has declined by about 8% over the past week, but promisingly, the test positivity rate has declined further, confirming that that decline in cases or infections that we're seeing is real and not just an artifact of testing. So currently, the test positivity rate nationally is at 12.4%, coming down from just under 16% a week ago. At 12.4%, it means that 1 in every 8 tests that we're currently conducting is returning a positive result. So hopefully in the coming week, we'll move below that 10% level and start to breathe a sigh of relief.
All right, let's look at the provinces now, and we'll see all the tails going down. So coming out of the wave. Just run us through, I mean, because everybody's followed a different course. Just run us through what we're looking at.
Yeah, so promisingly at the moment, all of the provinces have surpassed the peaks of their third wave and are all on sustained downward declines, which is really good news as well. If we look at Gauteng and its neighboring provinces, they peaked first and continued their sustained decrease. Gauteng, by all indicators, has exited the third wave. And promisingly, the coastal provinces of Western Cape, KwaZulu-Natal and Eastern Cape, which were lagging in this third wave, are on a decline as well. And then Northern Cape and Free State, which have been on a stubborn plateau for a long time during this third wave, are finally now on a downward trend, and we can say that they have also surpassed their peaks.
Let's stay on this graph. I mean, Gauteng, you can see there, is, in a sense, off the charts in comparison to the other provinces. That was despite earlier predictions. What's the belief around this right now, Doctor? Why Gauteng just had this incredible spike in this wave?
Yeah, so I think there are probably a couple of factors that were responsible for this devastating third wave that we saw, particularly in Gauteng. We know that Gauteng's second wave during the summer months was less severe than the coastal provinces relatively, and so there was a lower immunity and lower seroprevalence, and therefore more people susceptible to infection this time around. And so we saw that many more people being infected during this third wave. We also saw that the Delta variant emerged and was largely and pretty much dominant across Gauteng and all provinces, and Delta is much more transmissible, almost twice as transmissible as the previously dominant Beta variant, and that sort of spread rampantly throughout the province. And I think also Gauteng this time around was one of the earlier provinces to start seeing a rise in infections, and so probably saw the brunt of the third wave before any restrictions started to have any possible effect.
Yeah. Doctor, staying on this graph, we have some breaking news. The presidency confirming that the president will speak tonight at 8 o'clock. So we were talking earlier about the last time we were at these levels. Do you think there's scope to go down to 2 or even to level 1?
There certainly is justification to ease some restrictions at this stage. If we look at the data and the trends in the data, it does support some easing of restrictions. As indicated, all of the indicators nationally are on a downward trend, but also, as we just looked at, all of the provinces have also surpassed their peaks and are moving downwards. So I think there certainly is scope to ease restrictions at this stage. We have been in level 3 now for 7 weeks, I believe. So I think we probably have gained as much as we could out of level 3 and hope that we'll continue to see a decline even with easing of restrictions. Arguably, there's possibly even scope to move to level 1. Given our track record, I think we'd probably err on the side of caution and move to a gradual easing first to level 2 and hopefully not see any resurgence or exit wave. And then if the trends continue, we may possibly thereafter move to level 1, I believe.
When government looks at lockdown levels, the initial rationale for everything, of course, was to ensure that hospitals weren't overwhelmed. So let's look at the picture regarding hospital admissions. Take us through this one.
Yeah, so promisingly, hospital admissions continue their decline as we've been seeing for the last couple of weeks now. Nationally, we've had just over 6,300 new hospital admissions across the country last week, but that figure has decreased by 23% compared to the previous week. And also promisingly, all of the provinces are showing a decline in new hospital admissions as well. Of course, some provinces showing a further decline than others, particularly if I speak to doctors on the ground here in Gauteng, they certainly do confirm that the trend that we're seeing in the numbers is what they are seeing in the hospitals. But hopefully all of the other provinces that have peaked will now start to or continue to see a decline in new hospital admissions and a lesser burden on healthcare workers and the health facilities in general.
Finally, and unfortunately, the death rate can remain high even while the cases come down, but it looks like there's also been a significant drop in the death rate. Let's bring up that final graph.
Yes, as we know that deaths do lag, and we're reporting a high number of deaths, an average of 201 new deaths per day nationally over the past week. But the good news is that figure has declined as well and down 25% week on week. As we have been seeing with the previous indicators or the leading indicators of cases, test positivity, and also the hospital admissions decline, we will likely and hopefully see that the number of reported deaths will decline for the next few weeks and hopefully months. Promisingly, also all of the provinces are starting to show a decline in the number of reported deaths as well.
And before we let you go, so there's a positive picture overall coming out of the third wave as a country completely. What are your expectations around the dreaded fourth wave, looking at our vaccination rate, looking at the courses of the other waves, or is it simply impossible to tell how soon, how quickly? Of course, the variants will have a role to play here as well.
Yes, all of those factors that you mentioned will, of course, come into play in factoring when we will likely see a fourth resurgence. As you indicate, we have to look at the vaccination numbers. We're still waiting for outcomes of indicators by vaccination status in the country. So waiting to see the effects of that. And I think that vaccination rollout will continue. But of course, the other factor that we do need to bear in mind is the possibility of any new variants emerging and whether those may become dominant. We know that the previous three waves have all been driven by a variant that has been dominant. So whether or not we will see another variant, we just don't know. But if we look at the trajectories of the previous three waves now and the timing between those, it is likely that we'll probably see a resurgence towards the end of the year. How severe it may be, how long it may last, I think those are all factors that we just don't quite have a handle of. So we just do need to remain vigilant and hope it won't be as severe as what we have seen thus far.
All right, thank you very much, Dr. Ridhwaan Suliman, Senior Researcher at the CSIR. So that is the health picture that the President will be looking at tonight when he addresses the nation and talks about possible changes to our lockdown level. The COVID numbers definitely coming down across all provinces. And we have confirmation for you that the President will be speaking at 8 o'clock tonight. And of course, we will bring you that address live. Let's take a look at the weather.